All right, go ahead.
All right, this is the presentation for the HIPAA group. So just a little bit of background information for it. HIPAA stands for Health Insurance Portability and Accountability Act. It's also known as the Kennedy-Kassebaum Act, or bill, excuse me, based on the two main supporters of it. And it was signed by President Bill Clinton in 1996. And the main reason it was created was to protect the privacy of individual health and the ability to always have insurance.
Okay, the privacy and patients' rights under the HIPAA laws say that patients have a right to privacy of their health information. Patients also have a right to confidential use of their medical information, whether it's used for treatment, billing, or other purposes. They have a right to access. They have a right to inspect and obtain a copy. Whoops, I lost it. I can't see the page anymore. Sorry. Here we go. Patients have a right to inspect and obtain a copy of their health information, otherwise known as their PHI or protected health information. They also have a right to accounting of disclosures, so they have a right to know who has had access to their health information, and they can request an accounting of those disclosures for up to 6 years prior to the date of their request. They have a right to amendment. Patients can request an amendment to their health information at any time if they disagree with something that they find in their health record. They have a right to restrictions, so they can request certain disclosures not be shared with another physician or family member or even to their health plan if it's something that they've paid out of pocket for in full for treatment elsewhere. They also have the right to complain for privacy rights violations if they feel that a medical provider has used or disclosed their health information inappropriately.
Okay. So I'm doing COBRA. So what is COBRA? COBRA is the Consolidated Omnibus Budget Reconciliation Act, which stands for COBRA. It's made a health benefit provision to amend the Employer Retirement Income Security Act, the Internal Revenue Code, and the Public Health Service Act. It requires a group health plan to provide a temporary continuation of group health coverage that otherwise might be terminated. When the COBRA became active as part of HIPAA, on August 21st, 1996, the Health Insurance Portability and Accountability Act of 1996, which was HIPAA, was signed into a law, and HIPAA on Section 421 makes changes in the continuation coverage rule applicable to group health plans under the Conciliation Omnibus Budget Reconciliation Act, which is COBRA. These changes are effective beginning January 1st, 1997, regardless of when the event occurs. They entitles an individual to COBRA, continues with the coverage. How COBRA works? COBRA requires continued coverage to be offered to cover employees, their spouses, former spouses, and dependent children. Excuse me, as part of the health coverage would. Your group health plan must be covered by COBRA in order to qualify, must be enrolled in your employer's health plan. It generally applies to groups that have 20 or more employees. It can be hired privately or by the state, but not by the federal government. COBRA coverage is often more expensive than the amount that active employees are required to pay for their group health coverage, and the coverage can last up to 36 months.
So I have the COBRA violations, and there has been so many changes since it was created that it's almost nearly impossible for the employers to maintain compliance, which actually really shocked me that 90% of employers are out of compliance with COBRA. And since there's been about 12 changes by 12, some different organizations, some multiple times by the same organization have amended it. But when it's violated, you will receive a non-deductible excise tax. So it could be $100 a day per individual or violation, or it could increase by if it's a group that violated it, or just depending on the situation.
Okay, this slide talks about those individuals or companies that fail to comply with the HIPAA regulations. There's civil and criminal penalties. So I won't read through all of the different ones, but like the first one says individuals who did not know that he or she violated HIPAA. The minimum penalty could be $100 per violation with an annual maximum of $25,000 per repeat violations. And then the maximum penalty could be $50,000 per violation with an annual maximum of 1.5 million. And then the penalties increase depending on how severe, all the way down to the criminal penalties that could include like 1 year in prison, 5 years in prison. So those are all the different levels of penalties that I was able to find if these are violated. So, and some depend on if it was an intentional violation or if it was accidental. So.
And those are our sources.
Awesome. Thank you all for presenting that. That's great. So what I'm going to do now, again, I'm just going to ask questions. I'm going to work from the left of the screen across. So I believe that's Andrea. That's on the far left. Mm-hmm. And Andrea, what was something that surprised you, or something that that was interesting about HIPAA that you learned?
I think it's just that there are so many rules, so many things that medical practices have to be aware of all the time, just to make sure they're not in violation. I know from working for a surgeon in my ward for a short period of time that it was just intense. He was a new surgeon too, so it was just kind of a lot of work to try and understand what we could and couldn't do. I mean, for a while he was telling us to fax things to other, referring doctors, and we didn't know we were out of, line doing that. So that, there's several things that are really important to know, so you don't violate somebody's privacy.
Yeah, no, in the hospital I work at, we have to be very strict on things that you with patient information, and it's amazing some of the things that you'd think that are really harmless that are actually not, and could be actually a violation of HIPAA. So yeah, thanks for that. Shalise.
Oh, me? Okay.
Yeah.
So I didn't actually know COBRA was a thing, because I never had a parent that had insurance from their employer ever. I always just had private insurance. Okay. So that was news to me. So that was cool to learn, because now I know that I can use it in the future.
Yeah, COBRA's definitely a good thing for people that are out of jobs. However, it's super expensive. Mm-hmm. So, yeah. I mean, it's definitely a blessing there, but it's super expensive. Great. Yvonne?
I was surprised to see how expensive it is to actually have COBRA and use it. I heard of COBRA before, but I was not very familiar with it until I started searching and learning about it. Not a lot of people actually take advantage of it because it's really expensive. Right. But those who are able to do it, I was surprised that it will last more up to 36 months, which is a lot. I thought it was just like more like a 6-month thing, but it's not. So that was interesting.
Great, thank you. Morgan.
So I've heard of COBRA before, but I didn't know. I knew it was a type of insurance, but I did not know it was for those that were out of the job or like that. Like I've done a lot of medical classes that have dealt with, but it's mostly HIPAA because I haven't gone in depth quite like this. But I was also really surprised that 90% of the employers were out of compliance and didn't implement that into their business.
Yeah, that surprised me too. So
Yeah.
that's really interesting. You learn new things every day, right? That's awesome. All right, Noreen.
I found it interesting that HIPAA includes way more than just the patient's privacy. Like the covers the pre-existing conditions, the COBRA, the NPI numbers that the providers are required to have now, the 10-digit NPI, and even the transmitting of like the claims, the electronic claims, and everything is more standardized. So I found it interesting. It includes so much more that people don't realize. I guess I didn't realize.
Yeah, no, HIPAA has a huge purview of things that it covers. It was a really big legislation. So for you guys that are preparing for the test, you five that are on here, and then everybody else that's watching this, remember we're asking for. I just want you to know you need to know the different types of legislations that have happened in healthcare administration, and HIPAA is one of them. So remember that. Obviously, I can't tell you a whole lot more, but just know that. All right, so I'm going to go ahead and stop recording.